The fake is official. The suspected case count is at 600, and responders in Bunia are saying they don't have masks or motorbikes, so the declaration and the reality on the ground are not the same story. This is Ebola Watch. I'm Cassidy. Daniel's here with me, and today we're moving past the question of whether institutions would act and into the much harder one. Is the response actually reaching anybody?
We've got the WHO DG on record, a CDC advisory that travelers can actually read, and a Bunia dateline where motorbikes has somehow become a supply chain emergency. So yeah, all of that is on the table today.
And that 600 figure, we are saying suspected every time, because the confirmed count is still in the dozens. That gap is the number this outbreak is really telling us right now. Here's World Health Organization.
After declaring the fake, I immediately convened an emergency committee under the IHR, which met yesterday and agreed that the situation is a public health emergency of international concern, but is not a pandemic emergency. WHO assesses the risk of the epidemic as high at the national and regional levels and low at the global level.
The DG's remarks keep two counts separate, and we need to do the same. 51 confirmed cases in DRC, Ituri and North Kivu, with Bunia and Goma specifically named, and roughly 600 suspected cases in the rundown. Those numbers are not interchangeable, and the gap between them is the story this morning.
And the DG did something procedurally unprecedented. He declared the PHEIC before even convening the emergency committee. The committee met afterward and agreed with him. So that follow-up question from yesterday is answered. It's formally a PHEIC, not a pandemic emergency, and the committee signed off.
Right, and not a pandemic emergency is a meaningful distinction under the amended IHR, not just diplomatic hedging. The DG also said global risk is low. What that doesn't answer is the 549 case gap between confirmed and suspected, or the responders in Bunia who are out of motorbikes and pain medicine.
That's the Bunia dateline I can't let go of. If the PHEIC is supposed to unlock international response, then I need to know what exactly is being unlocked and for whom, when named responders on the ground are still waiting for masks and motorbikes the day after the declaration.
Here's CIDRAP news.
There are now 600 suspected cases and more than 160 deaths in a growing Ebola outbreak in the Democratic Republic of the Congo, DRC, and Uganda, the World Health Organization, WHO, said today, with numbers expected to rise. Our absolute priority now is to identify all the existing chains of transmission. Chikwe Ihekweazu, MBBS, MPH, WHO Emergencies Chief, said today at a press conference.
Let's be precise about what 600 means here. WHO is reporting 600 suspected cases against 51 confirmed, in Ituri and North Kivu combined. That gap isn't a rounding error. It's the detection problem we've been tracking all week, now with an official number attached to it.
And WHO's own emergencies chief said today that identifying all the chains of transmission is still the priority, which means they don't have them yet. So 600 is probably the floor, not the full picture.
The U.S. pledge to fund 50 treatment clinics is worth noting, but I want to know where those clinics land relative to the 9 affected health zones. A funding commitment in Washington has a very different operational weight than supplies already moving on the ground in Ituri.
Which brings us right back to Bunia. First responders there are short on pain medicine, masks, and motorbikes. Motorbikes. Because if contact tracers can't physically get to the next village, those 50 clinics are treating patients nobody found.
Here's Erica Smwisi and Clement Bonnereau at SRN News.
Bunia, May 20th, Reuters. First responders fighting Democratic Republic of Congo's 17th Ebola outbreak say even basic supplies are scarce, from pain medicine to motorbikes for contact tracing and face masks, complicating efforts to turn the tide on the disease. The rare Bundibugyo strain of Ebola circulated for weeks undetected in Congo's remote northeast before the first samples tested positive last week.
The Reuters dateline out of Bunia this morning puts names and a supply list to something we've been talking about in the abstract. The IRC's Congo country director, Heather Riot-Kerr, saying facilities in affected areas are operating without basic protective supplies, PPE, pain medicine, and motorbikes for contact tracing. That's not a system warning anymore. That's a reported fact from the ground.
I want to stop on the motorbikes for a second, because that's the one that actually breaks the whole response logic. You can pledge 50 treatment clinics, and the US just did, but if contact tracers in Ituri can't physically reach the next village, you're treating patients you never found. The clinic funding is downstream of a surveillance problem that runs on two wheels.
And Riot-Kerr is pointing directly at USAID dismantlement as a contributing cause. Specifically, PPE kit provision to health facilities was previously donor-funded and has been significantly reduced. That sits in real tension with the U.S. clinic pledge announced this week. Funding a new clinic while the PPE pipeline that fed the old ones is broken is not the same thing as a functioning supply chain.
So the Bunia story also answers the question we were asking yesterday about those 11.5 tons of supplies. Where did they land relative to actual case clusters? Based on what responders are describing on the ground, apparently not close enough.
AHA News writes,
The Centers for Disease Control and Prevention yesterday issued an advisory on the Ebola disease outbreak in the Democratic Republic of the Congo and Uganda. The agency said the risk of spread to the U.S. is currently considered low. The notice includes recommendations for clinicians and guidance for U.S. travelers visiting DRC or Uganda.
CDC's advisory is now on record, and the agency's headline is that U.S. spread risk is currently low. That's the official characterization. What the advisory doesn't resolve is the confirmed versus suspected gap. WHO is reporting 600 suspected cases as of this week, with confirmed cases still in the dozens, and a federal advisory that says low risk is not the same thing as a clean epidemiological picture. That's a fair pressure point, and it connects directly to what we flagged yesterday about the U.S. posture shifting from restriction toward engagement. Funding 50 treatment clinics is a resource commitment. A traveler advisory with clinician guidance is a different kind of document, aimed at a different audience. What I'd want answered is whether the clinical recommendations in that advisory reflect the confirmed case geography or the suspected case geography, because those are not the same map right now. If Ebola Watch helps you follow fast-moving crises, try Iran War Daily, a daily foreign affairs briefing on the U.S.-Israel-Iran war, strikes, ceasefire talks, Hormuz, oil markets, and Hezbollah spillover. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. So if one caught your attention, you can go straight to the source and read more. That's Ebola Watch for this Thursday, May 21st. This is a Lantern podcast.